my pearls, I have a mixture of diseases and tricks on aspects of pediatric derm practice, but it does really go from infancy up until teenagers because that's the breadth of pediatrics. And of course, um, my desire is to help both dermatologists who might be seeing children, but it's not their main activity. And so the messaging is different. So, for instance, I discussed towards the end of my discussion treatment of facial hemangiomas and the association with face syndrome. And the takeaway from that is that we're way more established in terms of how we want very early diagnosis or rule out of face syndrome and very early therapy to minimize what can be tremendously deforming. And um, and so that's a message to pediatricians and general physicians, and then to dermatologists if they're not expert, to when they see those patients, send them on to people who are very comfortable using propranolol and probably pulse dye laser down the line, or there's many different things that we can do that markedly change the life of the individual. So that's showing that there are these neonates. It might not be a general thing that dermatologists see on a regular basis, but if you see one of these patients with large facial hemangiomas, it's like it's standard. We have to rule out whether they're syndromic if they have major arterial anomalies or brain anomalies, and then we manage that very quickly and have incredibly different outcomes than we used to. Um, the next messaging or discussion is on atopic dermatitis, and that is uh, raises the question of when do you treat, and there's evolving data on terms of the impact of treatment. So, um, so part of what I discuss is sort of what are the core things you can get at in the room with a child in particular from the family impact of the individual and what questions you can ask to quickly assess how the eczema is impacting that child and the family and potentially move them on to systemic therapy if that's the right thing to do. So basically my messaging is that I have an approach where you sort of want to unpack the backpack of the atopic dermatitis issues, and it's instead of saying, oh, is atopic dermatitis affecting your family, which is one way of doing it, or just assuming it. There's just I just have a standard approach about questions you can ask to get out loud in the room, the the really showing the impact of the disease. When was the last time the skin was totally clear? And then you have to say like totally clear, because they'll talk about like a month ago, and then you're looking at this lichenified skin. You need to say like totally to point to someone who has no eczema in the room. How much is the itch an issue? Yeah, specifically about sleep disturbance. If there have been infections, if it needed to be treated, you can talk about the consequences of that. You have to ask about allergies because partially there's an expectation that allergies are causing it, even though it's 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 a comorbidity. They're linked. You have to at least bring up that issue. And then are there things that the family is doing differently or that the child can't do because of the eczema? And then pairing with that we have to be advocates for the life of the child, and that takes work in dermatology, whether it be getting our new non-steroids approved so that we can try those in our regimens of topical steroids and or moving on to our biologic agents or oral JAKs. And then the other, I'll discuss a bit on if you have a child on systemic therapy, how long is that for and how do we sort of move from that? Because we have emerging data on the impact of the biologics on that course of the individual. What happens if you come off? And there's some variability in terms of whether kids go into sort of off drug remission and they don't need further drug, or if they can stay off drug and have some eczema, but eczema that was way not as severe as the severe eczema. So that's something that is, we need more data sets on that, but we have more experience with it. So yes, your question of early treatment For atopic dermatitis, it's definitely still probably the hottest area in atopic dermatitis practice, and with questions about how long do we treat for to make a huge effect on our more severe individuals to minimize the impact of the disease as well as the development of comorbidities.